Hello, everyone. How are you all doing today? It's Tuesday, May 28th. Tomorrow is my birthday. I'm 66. I feel 40. This is the Lymphatic System Health Live. We have a lot to go over tonight. I'm really going to show you how edema in the body, and we see a lot of lipedema nowadays, and lymphedema I've known about since decades. When I was a young boy, I remember seeing great aunts with their arms really, really big. I didn't know what it was. Now, being a certified lymphedema therapist for the last 20 years, I understand that, right? But we have to understand that it's more than just surgery. It's more than just liposuction. It's really what you can do every day to help edema. And if you don't gain control over edema, I can tell you it gains control over your health, your heart, your lungs, your brain. So that's my advice. And I apologize. I'm just getting over a virus. My son had it. My wife had it. I thought I skipped it, but I'm at the end of it right now. And my advice again, when you have a virus, make sure you're hydrating, make sure you're helping a little bit of lymph detox very gently, especially when you're done with a fever. You want to make sure you start moving a little bit, start getting your circulation moving to get some of that waste from the virus. Remember, viruses create a lot of cellular waste, and we know that from COVID. A lot more anxiety, depression, insomnia, strokes, seizures, neuropathy, tinnitus, a lot of everything since we've had COVID. But now a study just came out saying long flu, right? Not just long COVID. You could have the flu a few times and get stuck and not get well. So it's really all about cellular waste. And I believe that plays a very large role in edema, whether we have just a little bit of edema in our legs or we have lipedema or lymphedema. I'm just going to use edema tonight. But some people are just having swelling. I saw a lot of people like that who doctors would put them on a heart medication or some water pill. I'd work on them a few weeks in a row, and their edema would go down. But to me, it's not really that much of fluid. It is some fluid, but it's really about cellular waste and fats. And that's what's really filling our body. And it's affecting us greatly, and we don't even understand it. I want to thank Elise for showing up, Jody, Liana, and Trish, and the others who may show up. But this is very important, and I take this very seriously. I don't just think, oh, we have lipedema or lymphedema or we're gaining weight. I see it as it's creating every health problem we have. And that's not where the medical system is today. The medical system concentrate on cancer. When you get cancer, you learn about your lymphatic system. They really don't know what to do with it, so they poison it or radiate it, and then they say go home after your treatments. But that's where you have to really, and that's where some people you can have lymphedema anywhere from the day after surgery to 40 years later. It's just when your lymphatic system says I'm done, right? It says I'm done, and we can't let that happen. And that's why I'm here, right? I'm here to educate people, but I'm also here. I sell programs. I have a course online. I am a medical intuitive, so I do lymphatic work energetically, and it's very powerful. I've done hundreds and hundreds of people, and man, they feel it, right? They really feel me working in their body. And we'll talk about that more later. So we have to see how this system that cleans us, it's the body's sewage treatment system, has to do with why we gain weight, why we swell, right, with lymphedema and lipedema. And lipedema, I'll tell you, when I first published work about 18 years ago, I was already a certified lymphedema therapist, but I never heard of lipedema, right? Never heard of it. Then I published this work on how most diseases due to the buildup of cellular waste and the from the malfunctioning lymphatic system. And I started hearing from women from Spain, Great Britain, Germany, I mean, everywhere saying, we're swelling. We have our legs, and they would send me pictures. My legs look like this. And they would get column like, you would have ankle cuffs, and then it would start spreading throughout the body. But one thing they all had was they had other health problems, whether it was hair loss, whether it was eczema so bad that it looked like their hands were on fire, digestive issues. They had a lot of excess hair on their skin. There's a lot of different things besides just the edema. And that's where I started sort of contemplating that, most of our diseases are really the same. And over 18 years ago, I published work on how most diseases due to the buildup of cellular waste because the lymphatic system, this tiny network of vessels and nodes, is not cleaning us, and it has one little vessel on either side of our neck. So we can't just concentrate on our legs. We have to concentrate here to get the legs to flow. But not understanding the lymphatic system is really hurting all of us, whether we have edema or whether you have cancer or whether you have digestive disease like I had for 30 years. It went away in less than 30 days. My IBS went away, my restless leg syndrome, my heart palpitations, right? And my IBS was severe. I had it for a long time, very severe. My hands were cramping all the time. My back would go out, and I owned a massage therapy clinic, or two of them at that time. And I just didn't realize that it's more than massage. It's more than taking a few vitamins. It's really concentrating on your lymphatic system. And that's what I've become a master of. And that's what we teach in our course. That's actually coming up, and I'll talk about it at the end on Monday. And we have a lot of people already signed up, and I can tell you, it's really all my work. It used to be a very expensive course. I decided I want to help more people, and put it into an 8-week course. And it's life changing. We've had hundreds of people take our course, and they are grateful. We get many compliments on thank you. How come this stuff is not understood? And it's not hard. It's just myth science, right? Science that we all need to understand, whether you have a child with autism or whether you're afraid of losing your memory as you age. And at 66 years old, and I work in the industry and I specialize in the brain, I've seen too many people lose their ability to think, and some starting in their 40s because they've had trauma in their brain. So by maintaining this one system, we can help edema. And I'm not talking about cure. I never talk about cure because I'm not a doctor. But you can make the greatest difference if you just start seeing a little bit of swelling. That's when you're going to make the greatest difference. If you start having some digestive issues, it's not been 10, 20 years, but trust me, mine went away in less than 30 days, right? So it doesn't matter when, but with edema especially, you have to gain control over it early, because if you don't, it gains control over you. And again, if you go online, and we'll probably possibly see, or in the studies that I put out today and tomorrow, look at the pictures in there, and you'll see some pictures. I was going to put a picture of a woman who I worked with for many months who succumbed to her disease because the doctors would just give her antibiotics, and that would shut her down. Her legs were the size of 3 of me, one leg. And the doctors didn't understand it. And there are a lot of women out there who have been ignored by the medical community. They just don't understand the lymph system. So they put them on a diuretic, and they put them in a hospital on antibiotics. Then they send them home. The people move a little bit. It shuts down their body. And so we have to avoid that. And it starts at any time, no matter where you're at. But if you have a severe case of edema, you have to start slowly. Because as you start to remove waste from your body, and that's a lot of waste in your leg, that's why we get cellulitis and other infections. As we open up the lymph system, it doesn't just take it out to the garbage. It puts it right back into your veins, right into your heart, and right back out into your body again. And that's why it'll affect their heart, it'll affect their kidneys, it'll affect their brain, they'll have more anxiety. So then start slow. But if you're in the early stages, that's when you got to not fool around. You got to hit it early, and you may be able to reverse it. But the most important thing is controlling edema. So I've been doing this for over 30 years. I worked up till about 3-4 years ago. When COVID came out, I was like, okay, I've been working for 26 years. I'm going to do something else. I decided to educate people. And that's what I've been doing. And we've helped hundreds of people around the world. And I also help people with distance lymphatic healing sessions. These are really, you sit at home. I tell you, okay, I look at your body. I tell you what I see. Oh man, I see you have a little congestion on your right temple, right between your eyes, by your sinuses. Your right shoulder all the way down to your left hip has a shear that might be interrupting flow. And that way you have an idea of what to do. I give you a few tips of what to do, and a few supplements that you can buy online. I don't sell any supplements, but I do know what you need. So sometimes purchasing an hour, if you're not ready for a course, you purchase an hour now, you'll get 2 45-minute sessions for the price of the hour. So my sessions really make a difference. Some of us are just blocked. Maybe as a child or as a teen, you had antibiotics. Maybe you had a virus. Maybe you had dehydration, or you took some meds, or intense stress. All these things tend to interfere. It could even be that when you were in the womb, right? Maybe your lymph system didn't completely mature. And we're finding out nowadays that the mom has to really do a little bit of exercise. She has to do movement in her body to get her flow going to help the infant. And even though the lymph system actually will mature a little bit, it grows much deeper into the body when, again, we put some force into it. So that's known. So if you're going to have a baby, make sure you're doing some light exercise. It's up to you to do deep breathing and movement, not too much intensity, right? We don't want to make you toxic, but that will make a great difference on how your baby develops, right? All right. So if you'd like to try a session, just let us know. I will put some information up a little bit later on about how to contact us and about the studies. But my goal is to really educate people. My goal is to change world health. And let me tell you, it's not easy because most people don't even know they have a lymphatic system. If you have edema, you do know a little bit about it, right? Especially if you have lymphedema and lipedema, you become the expert. Just as people who have a child with autism, you become the expert. Somebody with IBS, nowadays with the internet, you could become the expert. But what everybody is missing is the lymphatic system connection. Lymphedema and lipedema is excess fat and fluids. In autism, it's excess fluid in the brain of the child. They know more fluid in the brain, more intense autism. NPH, normal pressure hydrocephalus. As we age, our brain fills with fluid and we lose the ability to move, and it really your body just shuts down over years. You're in a bed. So understand that fluid in our body is much more than lymphedema and the lipedema. It's anxiety. It's why we have panic attacks. It's really everything to me. And we need to gain control over this system, and then we do much better. And it's not really hard. Most people who take my course, I ask them, how long do you spend each day? Oh, about 15 minutes. That's it, right? It's really, I teach you a lot of small things, and that you can do in just 30 seconds, in a minute, 10 seconds, that will open up your body. And as we do these things throughout the day, like the lymph man shuffle that we're going to learn, which is powerful, I think we should all be doing that 2 or 3 times a day, and you'll feel a difference in your life. People tell me that all the time. John, I'm doing your lymph man shoulder shuffle. I feel so different. But it's really a program that I put together that, again, saved my life. I would not be here today. I had major problems, you know about. I thought I was getting cancer, and thank God 30 days later, it was going away. So just know that cellular waste has been linked to the buildup of many diseases. Exactly what I wrote years ago, right? 18 years ago. Type 2 diabetes is about insulin not being able to be made in the pancreas because the islet cells, your pancreas is right here, your islet cells are being damaged. Anxiety, depression, insomnia. What else? Osteoarthritis, arteriosclerosis, heart failure, breast cancer, lung tumors, MS, Huntington's, Parkinson's, ALS, and even a severe case of menopause has been linked to excess cellular waste in the body, right? Because we should have menopause, the women, but when we have an extreme case that's never ending, and that's because you're filled with cellular waste. That's the night sweats and all those things. All right. So I truly believe that every health problem, right, is really due to our lymphatic system not working, but we see it. We actually see it in lymphedema and lipedema. And when a child is born with a lymphatic problem, you see it, right? It's quick. It's within a few days to a week, and then they have swelling. But most of us are just having a compromised lymphatic system from the standard American diet, from stress, from pollutants, from really our diet really is a big part of it, but and immobility. And some people might be doing too much at the exercise, and it's affecting them. So we have to find a balance, and that's what I understand. I was very fortunate to learn from 3 world-renowned doctors. Dr. Upledger, craniosacral therapy, great therapy, taught around the world. Dr. Burrell, visceral and neural manipulation. I learned the visceral manipulation, how to remove the organs. Craniosacral therapy is more in the brain and spinal cord, working with that to help many health problems. And then what really moved me the most was Dr. Chickley, right? That's your superficial lymphatic system. It's right under your skin, and we don't even think about it. But we do see a lot of beauty marks. We do see a lot of blemishes on our bodies, rashes, pimples, and we never think that, oh, that's a lymphatic system problem. But it really is just inflammation because our lymphatic system is unable to clean. Those one little vessel on either side of your neck is not working. All right, so let's see if I left out anything else. Was a certified lymphedema therapist. I specialize in the brain, right? Even though I was a certified lymphedema therapist, I did that for years. My passion is the brain, so I really understand the lymph-brain connection, even though I work with everything. My goal is to help you understand that you have to take care of your lymphatic system. So lipedema is an inherited chronic progressive disease characterized by the abnormal accumulation of fat in subcutaneous tissue, mainly in the lower and upper limbs. Now, when I hear something about inherited, right, it's a gene, that genes can change with your diet. In the families, we tend to eat the same diet all the time, right? So same stress we all have. So even though genes may play a role, Dr. Dean Ornish has found that if you change your habits, you change your lifestyle, your diet, do a little meditation, some exercise, you can change your genes. So that's very important to understand. Primary lymphedema is an inherited or congenital condition. And I will show some pictures of some edema that causes a malformation of the lymphatic system, most often because of genetic mutation. Again, it's done early. I believe it's due to cellular waste. I really do. Means it's the same reason why a child has type 1 diabetes. It happened in the womb. If type 2 diabetes is about the pancreas having a problem, then it happened in the womb with the baby, right? The baby was filling with cellular waste. So it's really something that if we just have a little understanding of the lymphatic system, we can change our lives and our future family's life. I truly believe that. You just got to get them to listen. That's the hard part with families. All right. So you have to lead by example. That's what I try and do, right? I try and lead by, am I perfect in my life? I don't believe in being perfect because I have one life. I'm going to enjoy myself. I don't drink as much as I used to. I do some other illicit things once in a while. But again, I understand that we have to manage anything. I want a burger once in a while. I want to have a cocktail. I'm going off my birthday. I'll probably have a Bloody Mary. I like a Bloody Mary, right? So we have to learn that everything we do, even breathing air, is making our lymphatic system struggle, and we have to gain control over our lymphatic system. So primary is really, it happens early on, right? There are three categories: the congenital lymphedema at birth, up to 2 years, a lymphedema precox, meaning it happens in puberty, right, as they get a little older and often with hormones, and then lymphedema tarda, which is after 35 years of age. So this can happen really at any time, and it's not only dependent on surgery. I didn't have surgery. I had a lot of trauma to my right leg as a kid. Everything, I would fall on a little pebble. I would fall all the time. And my ankle was always swollen. I mean, really all the time. So all that inflammation clogged up my lymph system. I didn't understand it then. And when I was older, I started having swelling in my right leg. I had to wear a stocking for a year and a half or whatever in Arizona. And then thankfully, I realized that I had to maintain my lymphatic system. Within a few months, I didn't have to wear my stocking. And I believe most people, because I see a lot of people who have hardly any swelling and they wear a stocking all the time, where if they were to be able to drain it, they may need a stocking sometimes, but if they were able to learn how to drain it, take certain supplements, and eat a better diet, that I believe they wouldn't have to wear that stocking. And I've seen that with many clients. But again, we do want to have some prevention if you have a little more than minor swelling. So secondary lymphedema may happen if your lymphatic system is damaged from surgery, trauma, or radiation. And the symptoms of lymphedema and lipedema are the same: achy, heavy feeling, difficulty with movement, repeated skin infections, the skin becoming hard, that's fibrosis, and in lipedema, it tends to be soft, folds developing in the skin, wart-like growths, leakage of fluid. You'll see that as venous insufficiency. And it's just showing you the lymphatic system is a major system that must remove fluid. It's not working. So we have to open up here, and then we start doing better. Again, the stages really of both just sort of refer to how much swelling you have. Stage 1, 2, 3, or 4. 1, you have the best chance of helping it. 4, it's going to be a lot harder, and you have to take it easy. But 2 and 3, you better really start paying attention to it. Complications, you can have painful swelling, difficulty walking, stiffness, stretched skin can become itchy all the time. That's little infections under it. Scarring can happen, like from cellulitis, poor blood circulation, loss of elasticity in your arteries, veins, and joints. So it's affecting more than just your skin, and you can get the ulcers. And again, it's all due to lack of circulation. That's why we get those skin ulcers, right? And you'll see them on some of the pictures when I send out the links to the studies. Go and look at them, and one of them really shows a lot of pictures. It's really very informative. All right, so let's go ahead. I'm going to show some studies. I love showing studies because it's just science. Why wouldn't we want to show science? And I am very science-based, right? Even though I work in energetically, and trust me, I made fun of doctors who did that in my first craniosacral course when I first started doing this work. I made fun of doctors, behind their back saying, Look at these Israeli doctors doing energy work. Well, you have to touch the body. Well, now for the last 20 years, I've been doing the energy work, and it's really profound. It helps many people. All right, so let's go ahead and get started. And I hope this is making sense. I hope this is you guys are learning something. If you are, put in the comments what you're learning, or if it's making a difference on your understanding of the lymph system and edema or most health problems. All right. Sorry, here we go. Talk too much. All right. So this is our deeper flow. We'll see a picture in a minute of the superficial flow. And actually the superficial flow right under your skin is really has more lymph in it than the deeper flow. So that's why we see it in the skin so much. So many disruptions, eruptions, pimples, right? Beauty marks, all the different things. But think of it as a plumbing system that must flow. It must flow. And it can't. And where does it have to flow? Right up into the neck, and it's not doing it. So if we don't open up our shoulders, then how is our legs? How is our pelvis? How is our hips? How are your arms, your hands? How are they going to flow if this area where the major lymph vessels are, right? So my goal is to show you that you have to do some little maintenance every day, right? We have to start thinking about it. If you have any health problems, please check with your healthcare practitioner. And if you, excuse me, if you are on any medications, don't just stop them. Talk to your doctor about weaning off them and what meds you can wean off of. So this is your superficial lymphatic system. It's really right. If you were to touch your skin, you'd be right on it. So this is the reason why we get in the center, we get pimples in our chest, why we get a lot of rosacea, why we get lupus butterfly rash, why we get cold sores. If you have cold sore, that's a sure sign that you have a weakened immune system, which is your lymph system, right? Ear fluid. We're talking about fluid today. So fluid is not just in our skin. How many kids I knew growing up had ear tubes put in because basically they would give them antibiotics for earaches over and over and over again, and that would shut down their lymph system, and then they would get excess fluid in the ear, and they'd have to put tubes in. So there's a lot of reasons why we want to get this flowing, but really to help edema, get rid of fluid, and really to help your brain. It's very, very important. So think of this system, have this green picture in your mind, but look at the major lymph vessels right here. One little vessel, that's it. It's like an angel hair pasta. One little angel hair pasta on either side of your neck has to handle the thousands of vessels and hundreds of lymph nodes, about 600 in the body. So again, if we slouch, if you're on a computer all day and you don't realize that you can't slouch, once you slouch with your abdomen on your ribs on your abdomen and your forward shoulder tilt, you're slowing your lymphatic system, possibly stopping it. So if we sit like that 8 hours a day, guess what? That's why they found that, sorry, I'm just getting over a virus, that if you sit for a living, you're going to shorten your life because we're filling with cellular waste. So when you're sitting, make sure you're sitting. And a lot of us are on computers. That's our lives nowadays, right? No matter what you do. So we have to sit up straight, be on a computer, get your screen up, and take deep breaths. That's why, and that way you'll be able to work for a living. Otherwise, you're going to get sick, and that's why so many people get sick. Because if we slouch, we stop here, and then we stop right here. The cisterna chyli, 3 vessels that have to drain everything in the lower body. So if we're slouching a lot, and some people just stand and slouch all the time, there's always slouching, then you're limiting flow out of your body and maybe creating a lot of or adding to a lot of your own problems. So think of posture and how we have to straighten up. And in a lot of diseases like lymphedema, Dr. Roxon, he's a specialist, one of the best known on lymphedema, studying it. And he's found that if you have lymphedema, that you're going to have a quicker route to most health problems. And that's because most health problems are due to cellular waste, in my belief, right? But I had IBS, and IBS is a component of many diseases. We don't just have one disease, most people. So IBS is affecting a lot of people. And think about it. Why are your intestines becoming inflamed and Crohn's, colitis, SIBO, which is small intestinal bacterial overgrowth? Why are you getting leaky gut? Look at this. It's because your lymph system can't clean waste, and that's why you're getting leaky gut. So we have to open up here and here to get our lower body flowing better. Even your arms, if you have swelling in your arms, it's dependent on here. Lipedema can spread everywhere, right? And lipedema can become lymphedema, right? It's just as you get worse and worse and worse, you just continually swell. If you have mild lymphedema, lipedema, edema, you have to gain control over it to avoid those problems. So again, this is what's happening when we're swelling. This little vessels inside and out are not cleaning us. And whether we want to get rid of edema or live a healthy life with our mind intact and have a lot less disease, especially if you want to work and make money and have a full life and enjoy vacations, then you have to maintain this system. So I was a certified lymphedema therapist. 2 studies in 2005 linked fat and obesity to damage lymph vessels. We really never hear about it. And this is what we're used to. Cellulite, we call it, right? It's not cellulite. It's just cellular waste building in the body and fats, right? Look here. There's a lot of fluid up here. So if I took this down, it would have rolls on our body. So our skin just stretches as fluid just keeps accumulating in our body. But this is a lot of fluid and waste. In lipedema, if you have an ankle cuff developing, you need to take really quick notice and get that taken care of and start addressing your lymphatic system, because lipedema will grow up to below your knee, over your knee, and then just keep on spreading throughout your body. I know some people who have lymphedema who have to put compression on their whole body for hours a day. All right. So again, it takes a lot of work to control it. So if you have early stages is when you have to be most proactive. Later on, you have to take it easy and go slow and work slow. And this is lymphedema. Sorry about that. Lymphedema basically is due to many surgeries, cancer removal. I didn't have, I just had injuries, and I would have had lymphedema if I didn't know how. And it's something I have to maintain my leg, right? I maintain it with supplements, drainage every night. I don't go crazy just on that leg. I drain my whole body. Once in a while, I'll drain that leg more, and I'm able to keep it really under control, and that's the most important thing. Oops, all right. So defective lymphatic vessels identified as a novel cause of adult onset obesity. This is one of the studies. This is the evidence in an in vivo animal model showing that defects in the integrity of the lymphatic vasculature could lead to adult obesity. If your lymph system can't clear waste and fluid and fats out of your body, and what they found with the study is they took the PROX1 gene from mice, and the lymph vasculature became leaky and had holes in it, and they get fat, the mice. So again, we want to avoid that, and that's happening to us later in life because we're ignoring it. But I believe a lot of what's going on with us, again, my work really explained how when we fill with cellular waste, because our lymphatic system becomes acidic, it's really because our bodies become acidic. Have you noticed that we spend over $2 billion a year on antacids and Prilosec? That means we have an acid problem. Now, brain acidity linked with multiple neurological disorders. So if you have any type of anxiety and depression, you have MS, a lot of diseases, then you have to realize it's really about your brain becoming acidic. The extensive collaboration, and really, I believe it's your body and brain. Here, they just found a brain. Maybe in a few years, they'll find a body. But I wrote that 20 years ago, that most diseases do an acidic body and brain, stopping your lymphatic system, creating acid waste to build up. And that's exactly what's been found. So this is a big study, 131 scientists, 105 labs, and identified changes in brain acidity and lactate levels, which are just a byproduct in your brain, in animals as key signs of this metabolic dysfunction. Animal models representing depression induced by stress, diabetes, or colitis, all of which lead to a high risk of depression, displayed a consistent pattern of decreased brain pH, which is an acidic pH, and increased lactic levels. Because when we become acidic in our brain or in your body, it can't clean because you've stopped the lymphatic systems. They constrict. I get passionate. Do you guys realize that? Because I feel this is hurting all of us, right? I'm not here to just sell you, oh, you got to come. I'm here to tell you, if you want to save your life, you really got to understand my information. I have no doubt about that. Lymphedema and obesity, is there a link? I bet you there is. We hypothesize that obese patients are at a higher risk for lymphedema because they have a baseline impaired lymphatic function. So if you are overweight, you already have a impaired lymphatic function, right? So that's why we have to lose weight, and then your lymph system starts working a lot better. Lipedema can be treated, and I'm not going to go through this whole thing. There were 5 cases. This is a study I'd like you to look at, and I'm going to put up the links in a few minutes. Lipedema can be treated non-surgically, reported 5 cases, because Most of the time with lipedema, doctors, they push you into liposuction. That's the big thing nowadays. But if you do that, you still have to understand diet, supplements, and self-lymphatic drainage. You have to take more responsibility, and then the liposuction will do better, because sometimes it just comes back. Clinical treatment was provided with anti-inflammatory dietary measures, aquatic physical exercise. I'm from Brooklyn, New York. I say words different. Manual lymphatic drainage and antioxidant herbal medicines. You don't need medicines, you get supplements, right? So by changing the inner environment, then you can make change, but you have to change your diet, take some supplements, and learn how to drain. And then you can really gain more control. But even if you have a liposuction, you still have to learn those things. So I'm talking about PCS. I could have picked endometriosis. I could have picked a lot of the different diseases, but I picked PCOS because a lot of women who have lipedema and lymphedema had this as early on in their life. So PCOS is polycystic ovarian syndrome. Teens with obesity and PCOS have more unhealthy bacteria, gut microbiome, which is very big. If your bad bacteria gets out of whack in your body, then you're just going to fill with cellular waste. Gut microbiome may play a role in PCOS and its related metabolic conditions, which are what? IBS, anxiety, depression, a lot of things we can have with PCOS. Again, cysts in the ovaries, problems with pregnancy. Teens with obesity and polycystic ovary syndrome have more unhealthy gut bacteria, suggesting the microbiome may play a role in the disorder. I agree. It's very important that we take a probiotic because we've had antibiotics in our lives probably too often. They can damage and will the other medications too damage our microbiome, and it just doesn't replenish because you take a probiotic once. You have to keep on replenishing it. So it's a good idea for everyone, even with lymphedema, to be taking a probiotic. These girls had more unhealthy bacteria in their stool, which was related to high testosterone levels and other markers of metabolic syndrome, such as higher blood pressure, liver inflammation, and plasma triglycerides. And all those things are happening because the lymph system isn't cleaning the liver. It's not able to pick up fats. It's not able to, the lymph system is a pressure relief system, right? And we know that metabolic disorders are really about cellular waste. Recent advances in PCOS management, I just read that. Weight loss should be prioritized for women with PCOS, since a healthy, balanced diet combined with regular exercise can boost metabolism, increase insulin sensitivity, and aid weight loss safely. This will improve their physical health. Patients with polycystic ovarian syndrome, ovulation dysfunction, and metabolic disorders may benefit from vitamin D medication, right? We all should be taking some vitamin D, but diet really, they might be mentioned a little bit when teens get, but what's really pushed is metformin. Oh, take metformin and it's really going to straighten you out. And what I've seen, and now they're actually not recommending it, right? Metformin. Some new studies are coming out saying it can actually make more the insulin sensitivity. So to me, change your diet. Don't just stop a medication right away, but you have to look at diet. Are you doing enough? Are you eating the right way? Are you taking a few supplements that can also help? And that's what I understand. So again, there's a lot of research always coming out. I'm always be looking at these things, and it really comes down to diet and what your inner body is, right? How is your blood? How is your lymph system? And they're toxic. Most people are toxic. And I just mentioned this because PCOS, lymphedema, people have anxiety, right? Well, everybody's got anxiety. There's even young children that having alerts come out saying that there's a big problem with children having anxiety. Why? Because we missed the lymph-brain connection. Our brain is cleaned by the lymph system, and we don't even discuss it in medicine. And here, there's a Mayo Clinic study. Obese mice lose anxiety when zombie cells exit their brain, right? Researchers have shown in mice that obesity increases the level of zombie or senescent cells. Senescent cells are cells that have excess heavy metals, excess fat. They're not able to clean themselves. They're unhealthy, right? They're actually decaying, and they give off a component that damages cells around them. So clearing the cells with senolytic drugs, they use a chemo agent in 2 mouse models, resulted in anxious behavior ending, lipid cells in the brain disappearing, and neurogenesis, or normal neurological cell growth, resuming. So if you have a lot of waste in your brain and neurons aren't going to be working well. And it's not that easy. Just, what they did in a study, just take some chemo. It takes a while. You really have to learn how to change your cellular environment and use your lymphatic system. Another problem with lymphedema also and the PCOS is type 2 diabetes. Removal of zombie cells alleviates causes of diabetes in obese mice. Researchers have shown that when senescent cells, also known as zombie cells, are removed from fat tissue in obese mice, severity of diabetes and a range of its causes or consequences decline or disappear. I hope you're getting that cellular waste is really devastating our body, and we see it in the body with lipedema and lymphedema. But again, diabetes, cancer, IBS, everything is really due to the buildup of cellular waste in our body. And that's what I published 20 years ago. So I've had a lot of time to figure out what to do about it. Is this making sense? I hope this is making sense to you guys. Just let me know in the comments if it is. Say yes or no. If you have a question, let me know too. Our findings show that senescent cells are a cause of obesity-related inflammation and metabolic dysfunction. Remember, everything comes down to metabolic dysfunction. How is your body metabolizing? And if your lymphatic system ain't working, then your metabolism ain't going to work. And that senolytic drugs, we don't want to take drugs, hold promise of the treatment of these conditions and their complications, which include diabetes. IBS, right? Again, part of PCOS. Dietary treatment more effective than medicines and IBS. And we're starting to find that in anxiety, they say that that exercise is better than medication. Here they're saying IBS, dietary treatment more effective than medicines. How can we not change our diet and just take a medication? To me, it's crazy. I never ate vegetables. I never ate fruit. I just ate meat, white rice, and pasta. And, once I changed my diet, I've learned to love fruits and vegetables, right? I never did before. And I eat meat, I eat bread, but I understand how to eat them sparingly and how to clean up after them. Dietary treatment is more effective than medications in irritable bowel syndrome. With dietary adjustments, more than 7 out of 10 patients had significantly reduced symptoms. And I had it very severe, I can tell you. Diet has worked. And I'm not a fan of the food maps. It's really just eating more fruits and vegetables. If you have diabetes, more low glycemic. Of those who receive traditional IBS dietary advice and low content food, FODMAP, 76% had significantly reduced symptoms. In the group receiving low carbohydrates and high protein and fat, the proportion was 71%, and the medication group, 58%. So again, a much better result with diet. With this study, we can show that diet plays a central role in the treatment of IBS, but that there are several alternative treatments that are effective. But again, you got to change your diet. So it comes down to everything in your health depends on these senescent cells. They're zombie cells, and they're all science is coming out that if you want to extend your life, if you want to get rid of diseases, if you want to age more gracefully, we have to get them out of our body. Cellular senescence can be pro-inflammatory, meaning that dead cells are sitting in your body. In aging and obesity, senescent cells accumulate in many tissues, including fat tissue, which is adipose tissue, brain, kidney, pancreas, and liver. That's why we get all these diseases like cancer in these organs. These senescent cells and their downstream effects appear to perpetuate inflammation and have been implicated in the pathogenesis of metabolic dysfunction, increasing immune clearance of senescent cells, and that's what I'm an expert in, holds significant promise for treating metabolic dysfunction, which is really all of our health problems in multiple tissues and disease states. All right, I'm going to talk a little bit about my course because I think it's life-changing. We've had over 300 people, only 2 refunds, and the reason we got the 2 refunds, one lady couldn't get into our program, and the other one was just so sick, right? So everyone else they're always thankful. They tell us, thank you very much for this. We're so happy that we're learning this. Again, you have to gain control over your health. You can work with your doctors better. 8-week online course, access to over 60 easy activities. Some are like a minute, some are 30 seconds, some are maybe 12 minutes, some are 25 minutes, but the majority of them are very short and easy to get through. And you'll actually, if you come on to the live on the Monday nights, I'm going to go through the whole lesson right then, right? So we're going to learn a lot during that time. And then you only have to go into the course to hit a few things that you're more interested in. Learn how to use dietary balancing, which is a big part. We just learned supplements, exercise, and the Ossipinsky method of self-lymphatic drainage for the mouth, eyes, ears, axilla, mammary nodes, breasts, arms, abdomen, inguinal nodes, pelvis, and legs. We're going to get you to learn how to drain your whole body. Each week, we're going to learn a gentle lymphatic detox. I'm talking about a couple of days, 1 to 3 days a week. We're going to change our diet a little bit. That's it. It's very simple because I'm not very good at changing my diet long term. But I am good at changing it a couple of days a week. And what I've learned when I do that a few days a week, I eat for the lymphatic system and drain myself and take a few supplements, that I just am more in control over my health, really within a few hours of starting a little cleanup like I do. take the course with the group. You don't have to follow anything I say dietary-wise, right? Some people are a little concerned about that. You can just learn what I teach and put that, whatever you would like, into your life. You have unlimited access for life. Zoom meeting every Monday for 60 to 90 minutes, 60 minutes or a little more going over the program completely for you. And then we're going to answer some questions. And it will be recorded, and normally I have it up by, that night or the next day. And every Thursday, we're going to do a little check-in, just a little check-in. I'm going to do a 15 to 20 minute where I'm going to get on a webinar, and I'm just going to say, hey guys, this is what we're supposed to be draining this week. I'm going to drain myself. I'm going to talk about diet that we're doing for the week, just to help out and give a little bit more coaching. But most importantly, it's simple. You'll know what to do from day one. And this is something you need to do really to help yourself now and in the future. Because what happens, we always have problems coming up all the time. And if you don't understand the lymph system, you're going to be confused of what to do and struggle. Where if you understand the lymphatic system, you're going to get what you have to do and know how to address your health problems. You'll feel lighter and have more energy and have more control over your mental and physical health. I have no doubt about that. And little bonuses now if you join. We're going to give you an extra month. So that's 2 months in the course and an extra month to answer questions, no charge. Where, I'm sorry, my nose is all itchy from the virus I had. An additional month to be able to ask me questions, which is really useful. A lot of people take a little time to go through the course, and I'll still be there for you. Receive a total of 3 months to be ask me questions. A PDF of my groundbreaking book, An Undetected Acid Alkaline Imbalance, and you'll get a PDF of it. And I want you to just say, how good would it feel to be able to have control over your system, to wake up in the morning and know how to do a couple of minute exercises that are going to get your lymph system going, how to go to bed and have your body cleaning itself much better, right? It's really science that we need to be teaching our children from an early age, and then we'll have a lot less disease. And that's my goal, is to have us all understand this so that we can start spreading the word of it. Because if we depend on the medical science, it's really never going to happen, I have doubt. So we are in a new era of the lymphatic system. This is from 2012. I published my work in 2006, but the lymphatic system and blood systems are two major circulatory systems in our body. The blood system has been studied extensively. The lymphatic system has not. And now in the last 10 years, a lot of research is coming out, and that's why there's so much focus. And I can tell you that the lymphatic system and it not functioning is really the root cause of most disease. And I hope you get that you really have an understanding and you go further to want to learn more about that. The author is, we hope to convince readers that the lymphatic system is no less essential than the blood circulatory system for human health and well-being, right? So it's something that every single one of us needs to understand. Did that make sense? Did you guys learn anything from that? I would love to know. Thank you, Elise. Elise, glad you're here, right? We need to be taking care of our lymphatic system. So I am going to, all right. So what are some ways that you can help lymphedema? Number one is exercise, because when we exercise, we're opening up this area here. We're moving our muscles, which contract the lymph vessels. So it makes a big, big difference. Thank you, Jody. I appreciate it. And make sure when you guys, when you post something, put it to everyone. And that way everyone can see your post too. Otherwise, I'm the only one who's going to see it. All right, so let's go ahead and what else can we do besides? And exercise is key. 500 million cells die every day in your body. 500 million cells. A lot of that becomes waste. So if you're not moving that waste out, if you're sitting around a lot, if you're stuck in bed and you're not moving, we've all seen those 600-pound shows, and people came and moved, but they get in bed and they start moving. They haven't stopped moving with water bottles, moving their arms, doing something, and over months they start getting better. And that's what you have to do. Just if you have extreme edema, you can't do too much at one time because it will affect your organs, and again, it just makes you more toxic. All right, Debbie, I'm glad you're learning with us. All right, so what else can we do? Concentrate on the upper body, right? The lymph band shoulder shuffle, I'm going to show you. Some people have to bandage, and that could take a long time. If you wear an elastic sleeve, if you know how to maintain yourself well enough, you may not need it if you're at a mild stage. If you're doing the compression pump, are you opening up your upper body before? Are you really maintaining your diet? You can't do compression. Are you eating more nutrients or cruciferous vegetables, right? A lot more broccoli. I love blueberries often when they're on sale. We'll buy 4 or 5 boxes of them and freeze a lot of it because I will eat a lot of it the first few days. But you want to raise your legs a little bit, keep infection, right? Don't be very careful if you have edema because any type of needle prick, any type of infection can really get very bad because it's an area that has limited circulation and lymph flow. So if it gets damaged by a vaccination or some type of a needle prick, then or even a bruise, you just touch it, it can get very severe. Again, cellulitis is life-threatening. So keep your skin nice and moisturized. Avoid the sun, sunburn. We went out kayaking, me and my son, the other day. We put sunscreen on, but he missed a few spots, and boy, you could see it just peeling away the skin, the layers, and that's very damaging to us, right? So we want to avoid sunburn and deep breathing. Deep breathing has a profound effect on our lymphatic system. Let's take a deep breath now. Let's just sit up straight. If you're slouching a little bit, you know you're going to really slow your lymphatic system. And just sit with your hands on your lap and take a deep breath. That's why we take a deep breath. We really big breath in and just blow it out. I can see lymph flow in people, and when we do that, I see a wave. It makes like a big wave in people, so that's going to help pick up waste. So one more time. All right. Uh, what else are we going to do here? Okay, so keto diet. I want to talk about that a little bit because I've talked to hundreds of women with edema, right? Since I published my work. And what they all tell me is that, they always push the ketogenic diet and you do great at the beginning, but then you eventually start gaining weight. And I'm going to explain that to you because the ketogenic diet it makes you slightly acidic and that makes you burn some fat. But what happens is you become too acidic and then it stops your lymph system and you start gaining weight, right? Fluid starts building. So I'm not a big fan of the ketogenic diet. I'm more of a fan of, hey, eat some meat, eat fish, turkey, chicken, eat some vegetables mostly, and you should have 3 or 4 the vegetables on your plate with some protein. That's the way we should be eating. So again, it's not just about drainage. And everybody should be taking magnesium. How many of you take magnesium? Everybody should be taking magnesium. I was just reading a study the other day. If you have open heart surgery, they give you magnesium. I have a brother-in-law who just had open heart surgery for an aneurysm, and my sister said, "Oh yeah." I said he should take magnesium. I sent him this study that said after open heart surgery, he should take magnesium because it helps, depression, all that stuff. And I said, what type did they give him? And of course, it's a prescription, right? You're paying out the nose for a prescription for magnesium. And it's oxide, magnesium oxide, which hope you know is only 4% absorption. So make sure your magnesium doesn't have really a lot of oxide, really no oxide. You want to use a citrate, something like that can really make a difference. But if you check your magnesium, if it says oxide, you're only getting 4% absorption where most the others are 90% absorption. So ketogenic diet, I'm not a big fan. Eat more fruits and vegetables, and you'll see you'll start feeling better. When I start eating more fruits and vegetables and I lay off the meat, grains for a few days, within a few hours, you just feel your body deflate, right? We just don't give ourselves time to do that. Let's do the Lymph Man shoulder shuffle. I think I gotta do everything. Everybody has any questions? If we have a question and answer, if anybody would like to put anything in there, I'm going to look at the chat. If anybody has a question, you can put it in there. All right, so we're going to do a Lymph Man shoulder shuffle, but if you guys would like to ask a question, again, I know I give a lot of good information, but if you have any questions, you can let me know. I'm going to put the information here. Let me see if I can put the information from the group. There it is. That'll go to everybody. There you go. So you have I didn't put all the studies. I just put the lipedema one, the lymphedema. Uh, I did put the information on our course. So if you're interested in our course, and right now it was $597, we're giving $100 off. So, and the first 10 people, we're almost there, will have a little talk with me. So make sure you contact us or we'll contact you when you purchase. Leg cramp, already taking magnesium. Jody, that's a good question. A lot of people, right? I was having such a severe cramp the other day. I had taken some extra supplements. I was draining myself, and I went and did a lot of exercise and a steam and a sauna. and I had such a cramp in my foot where I have a problem, right? I wore a stocking on that leg that I was like, and it took a day and a half to really go away. I mean, it would go on and off, on and off. I was like, this is what a heart attack is, right? And now my foot's fine. Why is my foot fine, right? Like two days later, my foot was fine. That was acid waste that I actually moved through my body, went into my worst part of my body, which is my foot, where I have a lot of problems in my leg, and it made it really problematic. And it took me a few days to get rid of it, but it's about the lymph system, right? I released waste and it got trapped. So I just kept on thinking, man, what happens if that was a heart attack, right? And that's what a heart attack is, acid waste constricting your heart or limiting blood flow. All right. Does insurance cover it? Not the course. No, the course does not, or therapy. If you have a diagnosis with lymphedema, you can go to a hospital and you can get some treatment if you've been diagnosed. Actually, they're supposed to. If you've been diagnosed with lymphedema, you're supposed to get your insurance. You get weeks of therapy, but you have to be able to get there 3, 4 times a week. And it's a lot, right? But often they will take care of it. But what I teach people is I teach people how to maintain themselves, right? It's great to go get a few 3 weeks of compression drainage, but then what are you going to do afterwards? And what I hear from most people is they really don't teach you a full drainage. They teach you how to drain a little bit. We need to know how to drain the whole body, everything. And then we make a wave through our body. It's like a tsunami, right? And then we start picking up waste better. When we just drain certain parts or compress certain parts, it just doesn't work as well. So unfortunately, insurance doesn't pay for it. And they may in the future, who knows? But Jody, with the leg cramp, you may have to take a little more. Look at whether your magnesium has oxide or if it's a good magnesium. And you need to be taking, the government says 345 milligrams. I believe most people need a little bit more. So make sure you're spreading it out throughout the day, your magnesium, and make sure you're drinking water. If you're not drinking water, right, and putting some minerals in it, then that may also be, because most drinking water and reverse osmosis has no minerals in the water at all. All right, so let's do the Lymphman shoulder shuffle, and I'm going to show how to drain the abdomen, because the abdomen is really so important. So the Lymphman shoulder shuffle, we're going to open up these little veins right on either side, little lymph vessels right on either side of your neck, right by your thyroid. And that's why the thyroid is the first organ to go, right? Then it tends to go into your TMJ, your heart, your breast. All right, but it does spread. So again, you got to keep this area going, and then we do much better. Especially if you had a thyroid issue, that means you had a problem, then you want to make sure you know how to open up this area, right? You want to just rinse this area off. Put your fingers against the trapezius, and just pump. I feel that my lungs just opened up, my legs just started tingling. I did that 5 times, right? So let's do the Lymphman shoulder shuffle. I understand all these little things that you need to do and what I need to do. Otherwise, I'd be in major, major problems I would have. But we have to maintain our health, and then we do much better. And I'm long-winded. I hope you guys know that. All right, let's do the Lymphman shoulder shuffle. And if you have any other questions, we'll answer them. But Lymphman shoulder shuffle, nice and easy. If you have no pain, surgeries in your neck, nice and easy, right? Just by doing that, I feel circulation throughout my body. I feel digestion, a little gurgling. I can feel my lungs opening up. My head's getting itchy. Now, if you have no pain or surgeries in your neck, really do it fast. Oh man, here you can hear my shoulder cracking. Right? We get tight, right? When our lymphatic system can't clean us, we get tight, and especially around our shoulders. That's why everybody's always straightening their neck. The Lymphman shoulder shuffle will open that up a lot better. Anybody feel a little different on that? All right. And for the abdomen, I'm going to show you here. Put your hand above and below your navel. Let's see if I can get my head in here. Put your hands above and below your navel and just scoop up. Scoop up. When I do that, I can feel it pulling out of my legs, right? So if you're sitting watching TV at night, do the Lymphman shoulder shuffle. Put your hands above and below your navel and just gently pump. Nothing hard. Just a nice pump. I feel that through my legs. I want to take a deep breath, right? When we move our lymphatic system, we help normalize body function. Otherwise, it's always shutting down. All right, we're at the end. Did that make sense, everybody? If it did, please let other people know about our group. Also, if you'd like any more information about our course, you will actually get, we have 3 options. Again, right, we go all the way down to 3 months because I want to help as many people as I can. So I think it comes down to like 3 months, I think something, but again, we have three options. You can buy it upright, you can buy it in 2 payments, or you can buy it in 3 payments. So we know this will make a great difference in your life. Don't hesitate, because we probably won't be doing the course for another 3 months, right? Every few months we do this course, and this is our main course. This is the major course right now. This is everything. You're learning everything. You're learning how to drain your body, your organs, how to drain your mouth, your eyes, to help your brain, and we're learning how to drain every part of the body. Also about diets, important supplements that I really understand and have researched extensively, and I don't sell any. I'll just tell you where to get them online. I'll go to Amazon. I don't make any money on them. All right, everybody. I appreciate you all, and hopefully I see you in my course. It's starting Monday. Have a great day. Bye.